A newly published study on vaccine effectiveness and the risk of COVID-19 reinfections was conducted right here in Rhode Island. Researchers from Brown University School of Public Health used state health data from March 2020 to December 2021 to determine if vaccines were protective or provided any benefits even after a previous infection with COVID. 12 News reporter Alexandra Leslie spoke with the lead author of this study. She joins us now with more on this. Alex.
Well, Chelsea, Joe Hogan, who chairs the biostatistics department at Brown, says the study came about amid a debate of vaccine effectiveness and vaccine mandates and if a prior infection provided good enough immunity. Hogan says the months of data showed prior infection by itself was not enough. Researchers at Brown University School of Public Health looked at Rhode Island Department of Health COVID-19 data involving long-term care residents, long-term care employees, and the general population from the beginning of the pandemic until December 2021.
So what makes our study stand out is it's a prospective cohort of a statewide population. I think it's probably pretty rare.
What Joe Hogan and other researchers at Brown found was that on average, completing a primary vaccine series after a previous COVID infection reduced the risk of reinfection by about half.
So for both employees and residents of long-term care facilities, the infection rate was much higher than the general population for those who remained unvaccinated. And so the benefits of being vaccinated even after a prior infection and recovery turned out to be really substantial.
Hogan says to their surprise, those whose prior infection resulted in a hospitalization were more at risk for becoming reinfected.
And I don't think we really have a strong explanation for why that is, but that was a pretty strong signal.
He says his main takeaway, if you haven't gotten the vaccine, to do so.
It's hard to overstate how overwhelmingly supportive the data are for the vaccine, and we have looked at it in health systems at the molecular level, at every possible level.
Now, this study was conducted when Alpha and Delta strains of COVID were predominant and before at-home tests were relied on. Hogan tells me testing surveillance may make additional studies challenging, but researchers are hoping to do a similar investigation for the Omicron variant. Live in studio, Alexandra Leslie, 12 News.